Hi friends. So I wanted to do another COVID update. It's been a while. I have a lot more information. I'm really fortunate right now to be taking an immunology autoimmune class for my master's in functional medicine with Dr. Heather Zawiski. So she has updated us with a lot of the studies coming out of Europe and China regarding COVID. And I just want to pass on the information that I think is the most important. So for starters, we know that there's 19 different phenotypes of COVID that we know of right now. So what does that mean? So a phenotype means the virus looks different in different people. And this is part of the problem, why people are having a delay in diagnosis sometimes. So the virus can attack the lungs, can cause clotting or attack the blood vessels, can be in the brain, can cause seizures and encephalitis, can be mainly in the gut and cause GI symptoms, or can go directly to the pancreas and cause an autoimmune diabetes. We are finding on autopsy of patients with COVID that the pancreatic damage is pretty prevalent. So those are only 5 different organs. However, all different combinations of those organ damage, those systems occurs. So in other words, you can get the GI version and the lung version together. You can get the brain version and the gut version together, right? In all different combinations. So there's 19 different ways that presents right now. I also wanted to mention that the nasal swab or the nasopharyngeal swab is testing for PCR. So it's a PCR testing, so it's testing for live virus. It's amplifying the virus if it finds any, and then essentially testing these big chunks in the lab of this amplification of the viral DNA. So the problem is you have to get far enough back as the person that's doing the swab, and usually that makes the patient gag. So the test is not sensitive enough, and what I mean is there's a lot of clinic error. So the lab may not be doing anything wrong, but the person who's taking the test is actually not able to get the Q-tip back far enough without making the patient gag, and they are essentially afraid to make the patient gag. They don't want the patient to be uncomfortable, and they don't want to get coughed or sneezed on. So the nasal swab is not sensitive enough. If it's positive, we know it's positive, but if it's negative, the person could still very well have COVID. The other thing is if you have a different version of COVID involving clotting, involving brain inflammation or the gut mainly, it's not going to be in the nasopharyngeal, right? So the saliva testing is actually more accurate. Saliva testing for the live virus. This is happening at Arizona State, and hopefully as the weeks go on, we will be doing this here in North Carolina. Saliva testing is more sensitive for systemic virus. Antibody testing, however, there's a problem. So patients who get COVID and then recover, if they either have a mild illness or they are treated, so the infection lasts about 5 days, the worst part, and goes away, then they often have an IgM and an IgA response, and they don't have an IgG response. And the problem with this is twofold. Number one, the antibody testing, the blood testing will not come back positive, so we won't know that they had the infection. The second problem with this is that IgM and IgA, they go away within 3 weeks. So you can test the person 4 weeks later and their blood looks negative for COVID. Now they still have T cells that responded to COVID, not antibodies, but T cells. But we don't have a way to measure T cells. So we don't know that they had it. It's possible that if they're exposed again, they will get over it more quickly, but we don't know that for sure yet. Some people are seemingly being reinfected 3, 4, or 5 months later. However, in some of these patients, it's very, very likely that the virus is just lying dormant and that it's actually present in the follicular dendritic cells of the lymph nodes, We know this not because it's easy to study the lymph nodes and the follicular dendritic cells, but because HIV does this, because herpes virus does this, because varicella does this. So we know this from other viruses that lie dormant. Think about what shingles is. Shingles is essentially the virus lying dormant until a time of stress when your IL-6 goes up, which I'll talk about in a second. So, how does anxiety or stress make you more prone to get COVID? Well, first of all, anxiety and stress make you more prone to get shingles, make you more prone to have insomnia, which then weakens the immune system, makes it harder for you to detox if you're not sleeping well. Anxiety and stress directly raise the pro-inflammatory cytokines in the body. If you remember when we first started talking about COVID, or when things got a little crazy in March, there was an article about elderberry that was specifically talking about cytokines. So something I want you to know is that there's good cytokines, pro-inflammatory, and there's also anti-inflammatory cytokines. And interleukin-6 or IL-6 is one of the cytokines that we make when we're stressed, when we have a major life change, even if it's a positive one, when we lose our purpose, so to speak, in life. And what happens when IL-6 goes up is that it triggers the rest of the pro-inflammatory cytokines to be released, and it throws the immune system off balance. Remember, all of the immune system and everything in the body is actually really about balance and harmony. Having too much or too little of something can cause a problem, right? So that brings me to our nutrients. So we know that people will have the virus longer and are more likely to die from the virus. Even though the percentage is small, they are more likely to die from the virus if they have micronutrient and essential nutrient deficiencies. So what am I talking about? Glutathione. Okay, everyone should be taking either 500 milligrams a day, or they should be taking NIC to make glutathione, because we're all under a little bit of stress right now. And if your glutathione is depleted, you're less likely to fight COVID, to be able to fight it. Everyone needs selenium, but too much selenium causes prostate cancer and anxiety and insomnia. So you need to be in the sweet spot of selenium. So let's check your selenium. If you haven't had the blood test, let's do it. Zinc. If you need zinc, then you should be taking zinc. Zinc with copper would be the most important. But again, only if you need zinc, not if you're high in zinc. So we need to check. The other thing I wanted to say is dysbiosis is a giant risk factor for not recovering from COVID. Dysbiosis is when the good gut bacteria are much less in number than the bad or the harmful gut bacteria. Dysbiosis also exists when you have very few species of gut bacteria. So we're supposed to have millions and millions of bacteria living in our intestine and in our colon mainly. And if we don't have that, then we have something called dysbiosis. So it's about the balance of the good and bad, and it's also about having enough. The best way to prevent dysbiosis is to make sure that you're eating 30 different plants per week. And so I don't mean servings, and I don't mean, all green lettuce 30 times. No, I'm talking about 30 different plants. So vegetables, fruits, legumes, and beans count. Things like rice and wheat, they don't count. Okay, grains don't count, but plants, vegetables, fruits, beans, okay? The other thing that we now understand that we didn't used to understand is that most people need about 1 million particles to get the infection. So typically this means you have to be in the presence of someone who has the virus for about 15 minutes before you can get enough exposure to have 1 million particles. And this is why surfaces are not as likely a high risk, because on a surface there may be 100 to 200 particles, but there's not 1 million typically. This is also why grocery stores are not an area for exposure, but things like churches, karaoke bars, restaurants, places where people are singing or salivating, hospitals, right? Those are places where the virus is being spread. Another thing that we now understand that we didn't used to know a few weeks ago is that the virus can be aerosolized in the hospital. So it may or may not be aerosolized all the time. It may be transitioning from a respiratory droplet to actually being aerosolized. So the problem is aerosolized is much smaller. Aerosolized, you would not be protected wearing a mask. You'd need to wear a plastic shield or like a welder's mask on the plane or in any area, restaurant, any school, any area where you think there could be aerosolized virus particles. But also our testing is very sensitive for aerosolized particles. So even though we see parts of the RNA in the air, does that mean that that's how it's being transmitted? We don't know yet. We do know that babies, newborns, are being found to have COVID because it's aerosolized in the air in the hospital. So now is the time more than ever to consider a home birth or a birth center birth, in my opinion. Okay. Obviously, all of this is my interpretation of the data. We don't think that it's always aerosolized like measles. Why? Because measles has an infection rate of about 1 person infects 18 people around them. COVID right now is about 1 person infects 2.5 people around them. So much better odds. It's probably still mostly respiratory. I think I covered everything, except for treatment. So if you get COVID, if you have autoimmune disease, obviously definitely call me, because you don't want to boost your Th1 response to fight COVID by taking herbs and things that will boost your Th1 response and make your autoimmune disease worse. If you don't know what Th1 is, then come talk to me and we can have a conversation. I'll do another video on Th1, Th2, and Th17. Dr. Saliba and I did do a talk about that, so that's archived, so I can post that. So we need vitamin D in order to regulate autoimmune disease. We also need it in order to fight COVID. So vitamin D is really important. Too much is not good because it downregulates receptors. So you need to take enough, but not too much. Again, we need to test your level to know how much you need. I already mentioned zinc. Zinc is also great if you do get the virus. Selenium, NAC, which produces glutathione. But I also want to mention adaptogenic herbs, things like astragalus, echinacea, elderberry, some mushrooms, and the mint family of herbs. So peppermint, lemon balm, oregano, and basil. Lemon balm is one of my favorites, and so is oregano for this virus. There is also, if you don't have autoimmune disease, there's also a mushroom blend. It has reishi, shiitake, maitake, and cordyceps, and it's called Comprehensive Immune Support. There's also Immucor. So those are some great ideas, things that I've seen help people depending on what type of COVID that they have. It's important to call early. Let me know right away if you have any symptoms. Keep in mind that the mortality rate is low, but if we send millions of children going back to school, even if the mortality rate is 0.5%, we still may have quite a few children get sick and sadly die. So we all need to be getting more information, talking about it a little bit differently, common sense. And I think that's it. Please, again, because anxiety increases those pro-inflammatory cytokines, do the best you can to have fun every day and to relax. Canoeing and kayaking are super safe. So if you can get out there and do those, hydrate. Thank you so much for your time. I hope that answered some questions. If not, let me know.